Okay, so I decided to do my presentation on neurofibromatosis. 1, because my brother has neurofibromatosis, and 2, because it's a pretty rare disorder that not a lot of people know about. The definition for neurofibromatosis are they're brain tumors they're tumors that form on the brain and the spinal cord area. They're called neurofibromatosis, and they're a group of 3 genetically distinct disorders that cause tumors to grow in the nervous system. They begin as supporting cells in the myelin sheath, which protects those cells. It's a type of tumor that develops depending on what cells are affected. There are 3 different types of neurofibromatosis, but we're only going to talk about 2. There's NF1 and NF2. NF1 is the most common type of neurofibromatosis. That's what my brother has. And it affects about 1 in 3,000 to 4,000 individuals in the United States. Between 30 to 50% of the individuals who have NF1 did not get it from genetic reasons. They got it from a spontaneous mutation, and they don't know why that happens. NF1 affects the 17th chromosome, and then you have NF2, which happens in about 1 in every 25,000 people in the United States. About 50% of the affected people inherit that disorder, so whereas for the other one it's 50 to 30. Most people get NF1 from inheriting it. More so people get NF2 from inheriting it, but same with that. It's from a genetic mutation and they don't know why. Hallmark finding in NF2 is the presence of slow-growing tumors on the 8th cranial nerve. So that's just going back to it's in your head and your spinal area. 5 to 10% of neurofibromatosis 1, those tumors become malignant. And then early onset with NF2 is associated with a higher risk of death. The causes are genetic, like we already talked about, and then also a spontaneous mutation in your cells, which is how my brother ended up getting it. Like I said, the NF1 gene, it's located on chromosome 17. It produces neurofibromin, which are a complex protein that regulates the division of central nervous system cells. And the NF2 gene, which is found on the 22nd chromosome, produces a protein known as myelin that suppresses tumors. So NF and IDEA, what are the co-occurrences between the two? About 50 to 60% of people who have NF1 will have some type of learning disability, whether that is like a flat-out learning disability or ADHD or something like that. They normally have problems reading, writing, and they have trouble with numbers. 50% of the problems deal with attention and executive functioning. So, like I said, attention deficit disorders or their gross motor skills, things like that. There is no cure for NF1, 2, or the 3rd type that I can't pronounce. But there is certain treatments depending on what symptoms you have for NF. For example, my brother has really, really bad headaches, so we treat those headaches. Depending on exactly where the tumors are located, you can surgically have them removed. Sometimes you can't. Depending on their malignant or benign, you can have them removed. Sometimes you can't. Generally with children, they'll have annual checkups, which is, like I said, like my brother had. So every year you go back and you get like an MRI or a CAT scan, just so they can kind of look around and make sure that everything looks good. If anything's growing, they can just keep an eye on everything. When Chris actually was diagnosed with NF, Vanderbilt didn't even have a children's hospital at the time. They just had a floor in the main hospital that was for that. And that was for like the cancer treatment, so that's where he went. So that's kind of like an idea. Not that many people have it, so it's not very prevalent. Some characteristics of NF1 are light brown spots on the body. You need at least 6 of those for that to be considered a symptom. And they're called café au lait marks, which in French means coffee and cream. And they have to be at least 5 millimeters in diameter for children and 15 for adults or adolescents. And they look kind of like birthmarks, but they're just little spots on their body. They have to have 2 or more fibromas or a plexiform fibroma, which is just a bunch of them combined into one giant one. And they have to have freckling in the area of their armpit or their groin, which Chris has. They normally have a tumor on the optic nerve, abnormal development of the spine, which is scoliosis, or the temple, or any other bones like the tibia. They generally have a large head circumference, which my brother does, and they tend to get headaches often, and they also become epileptic. For NF2, some characteristics, apart from all of those, they'll have a bilateral vestibular schwannomas. They have a family history of NF2. Like we said, 50% of people who have NF2 got it from their parents or somebody else. It's a genetic pass down, so more so when you have NF2, they're looking for somebody else in your family who has NF2. You normally can see NF2 before the age 30. The symptoms and characteristics are a little bit later to show for NF2. For NF1, they're much earlier. And then you have juvenile choroidal cataracts, so just that kind of stuff. Like I said, when Chris was in treatment or in the hospital for neurofibromatosis, they didn't even have a children's hospital, so they didn't even have like that section of the hospital. So he went to the cancer treatment. As currently, their research is being done, but there's not a whole lot known about it, and there's not a whole lot being done about it because it's not that prevalent. So it's hard to treat something that you don't know about. They think that genetic mutations affect the development of the fetus, so when they're forming in the mother's womb, they think that that's pretty much when things start genetically mutating. It's not necessarily afterwards that it happens, but it's normally afterwards that you realize that it's happened. Developing medications that can replace or balance proteins to regulate cell growth, because that has to do with the development too. Improvement in diagnostic methods, including parental genetic testing. So in like our case, neither one of my parents had NF, nobody in our family has NF, nobody in the whole entire history of our family has NF that we know about. And so if they, for some reason wanted to be tested, they could have got tested. For Chris, he has a 50% chance of giving it to his kids. So, once he has a baby in the womb, they can test, but it's more likely that he'll give it to his kids because he has it. The relationship between NF1 and NF2 and the third type, they're very closely related. So it's not like if you have one, you just have no other symptoms or types for the other one. Just they're pretty close together. Psychological therapy is really good for people who have NF because if you can imagine having like cafe au lait marks all over your body, like Chris has them all down his neck and on his legs, that would affect how you look at yourself and how you think people look at you. So a lot of times they have psychological, problems like thinking wise, they have anxiety and things like that. That's very typical. And they also tend to have cosmetic deformities like scoliosis or a larger head, or they can have deformed bones and things like that.